Your support helps us bring you programs you love. Go to WyomingPBS.org, click on Support, and become a sustaining member or an annual member. It's easy and secure. Thank you.
Wyoming PBS, with underwriting support from AARP Wyoming, takes a look at what it means to be a caregiver in the Cowboy State. We'll learn about some important end-of-life decisions families can now make. We'll meet a true Wyoming hero, Ella French, who has provided care for her mother for the last 16 years. And we'll also learn about what programs are available for support from the state of Wyoming. Caregiving, next on Wyoming Chronicle.
Funding for this program was provided in part by the Wyoming Public Television Endowment and viewers like you.
Our default button in medicine is to go ahead and keep doing everything we can do to sustain life, and that's correct. But not everybody wants that approach to their end-of-life care. What ISPOLST is, it's a form that documents the conversation held between a patient and a provider, talking about their goals of care as they approach the end of life.
This is a medical order that is signed by a provider, and it is the wishes of the patient, and so yes, by law, these are to be followed. It's an order from a provider, possibly outside of the medical staff there, but by law, the accepting providers have immunity to follow this without risk of following an order from somebody that's not on medical staff.
The main benefit is for the family, is that they can feel that after having a discussion about what their loved one's wishes are with their loved one present, they can feel very confident that they are fulfilling what their loved one's wishes are. Before we had ISPOLST, we didn't have a uniform way of documenting what patients wanted at the end of life. Now we have a form that helps frame a discussion.
So I've been very surprised that patients have been very open, very receptive to the form. In fact, I've had couples where we've been doing it for the patient who maybe is in their last year of life, and the spouse will say, gosh, I want one too, can I get mine filled out? It may be not where it's appropriate for them yet, but I think they've been very open, and it really kind of just gets the monkey off the back. They want to have that conversation.
This is different from an advance directive because it is a doctor's order, and it is actionable within the medical system. It is appropriate for EMS, and it's about the care the patient wants right now, not sometime in the future.
ISPOLST form should definitely, a copy should definitely be with the patient's primary care physician, as well as whatever local hospital that person may potentially end up in.
We are asking patients, when we complete the form, to hang the bright yellow form on the refrigerator that will tell the EMS what level of care that patient is wanting.
This needs to be part of what you do, not only for the benefit of your patients, but for the benefit of the providers around you, so that we know what your patient wants and what you want. You're the one who knows your patient. You've had these conversations. Don't let us guess at 2 in the morning what you and your patient want.
And it's our pleasure now to be joined by Dr. Cindy Works. Cindy, welcome to Wyoming Chronicle.
Thank you, it's nice to be here.
You're a physician in Casper with the University of Wyoming's residency program.
I am.
And our viewers have just seen a video that you participated in about ISPOLST. Let's start first with, why was there a need for this in Wyoming? Many of us have heard about advance directives, that those are how we tell physicians and maybe even our family members what is important. Why is ISPOLST so important?
So many of us who work with elders in this state, like I do, we're finding that we needed a tool to help take the conversations that we had with our elders regarding what they want done as they approach their end of life times. And so we just, these various people working with elders around the state were finding the need for this tool to kind of make these wishes known, so that when our patients, we'd have the conversations and hear their goals and what they wanted, but we didn't have a way to communicate it to perhaps like the emergency room doctor, where they might come after they'd had some kind of healthcare event. So POLST came up because we wanted a way to frame our conversation with our elders to kind of see what they wanted done. Now the POLST form specifically the guideline is to use it when you think there is less than 1 year of life left, but that's just a guideline, and we oftentimes use it with any elder that wants to have the conversation about what's important to them as they approach the end of life and what they want the healthcare system to know about them and what their goals of care are. And so this form was coming up in various places around the state. Jackson was using one, Laramie had one in the past, Cheyenne was using one, I was using one here in Casper. So we came together as a working group in 2014 at a medical meeting, and we decided that we really wanted to kind of make this a uniform effort. And because otherwise we were going to end up, obviously it was a tool doctors were feeling the need for, so they were kind of coming up with the form. We wanted to have one that would work across the entire state and be recognized. So we went to the legislature and proposed it.
Let's get into the nuts and bolts.
Okay.
I have to go to the hospital. What really is this form going to tell my physician?
So what happens is, this is hopefully framing, so the important thing to know is it takes a conversation that I have had with a patient, so that a provider has had with a patient, talking about goals of care at the end of life. So I don't know if you want me to give an example of a conversation, but
I think it would be helpful.
So somebody will come to me and I'll say something like, you've been in the hospital 3 or 4 times with your serious lung disease here in the last 6 months. How was that for you? And they're like, well, I don't really want to go back to the hospital anymore. I'm kind of done. I'm like, really? You don't want to go back there even if you were going to die? And we have this conversation. So what do you want done then? How do you want the healthcare system to help you? And basically, some of them will ask, I want to stay at home. I never want to go to the hospital again. I said, but what if you're really struggling to breathe and you can't be comfortable at home? And they're like, well, maybe then I would go. So then I asked them, so how much would you want them to do at the hospital? Do you want them to kind of, if you're having, for instance, struggling to breathe. I use pneumonia as an example. So say this is a person with lung disease that has a pneumonia. Do you want us to kind of just focus on keeping you comfortable until you die? Do you want us to try and fix it? And that kind of determines the level of treatment. There's 3 levels on the POLST form. Full treatment means that we would do everything. So I asked them, so do you still want us to give you antibiotics and the prednisone and all the other medical things we can do? And if they say yes, then I say, and if that doesn't make you better, do you want to then be on a ventilator? No, I never want to be on a ventilator. And many people will say that. So that's an understanding that kind of they want some treatment, but they don't want to go all the way to the end. But some people, after they've been in 3 or 4 times with their bad lung disease, just don't want to go back again. And if they and that would be the comfort-focused care, where they really just want to be comfortable and they don't want to fight this anymore.
This is a form that does not need an attorney.
No, it doesn't need an attorney. It's a doctor's order. It's different than an advance directive in that it takes this conversation where I've established what their goals of care are, and I try to be as explicit as I can. So I say to them, so if you need a breathing tube and you're going to die without it, are you still telling me you don't want that? And many people will say emphatically yes.
These are conversations, if a patient has with their physician,
yes,
that it would be wise maybe to have spouses,
yes,
or children,
or the caregiver,
or a primary caregiver.
Whoever kind of is important to that family. And when we complete this, we send several copies home with the patient and ask them to distribute it to their family. We ask them to take the yellow form, which is the gold form that we have decided is the color in Wyoming, to place on the refrigerator for EMS to be able to access it easily. And we also send copies. We put a copy in our record at the clinic and a copy at the hospital, so it's available to the emergency room doctors.
With our discussions off camera, I want to bring to the floor now, it seems like Wyoming has an issue in training first responders with everyone who needs to understand what this POLST form is all about.
Well, we got it passed in the legislature because we asked for no money. I think we didn't really have a budget attached to it, so there hasn't been a budget to train all the providers, to train EMS per se. I have gone around the state several places down in Commerce County. I've done some training with the doctors there. I've done some training with EMS here in Casper, as well as the EMS statewide meeting 2 years ago. So we've made some efforts, but because it's not my only job, it's hard for me to go out and promote the POLST and the correct usage. We really want this form to be honored and to really represent the wishes of the patient. The issue is not having the form completed, it's having those important conversations.
If I had to reduce your message down to one aspect, it's important that folks have this discussion with their provider sooner rather than after crisis happens.
Yes, and sometimes, yes, so that, and we do recommend a year of life. Like some of the times that I have it earlier is like in the setting of dementia, because I won't be able to hear the wishes of that person late into their illness. I like to have the conversation early on in dementia so I can really hear what, as this disease progresses that we can't stop, what do people want me to do in terms of the healthcare system.
Well, Dr. Cindy Works, it's an important topic. We've, throughout this segment of our broadcast, have had the web address where anyone can go and download this POLST form. On the show, we encourage folks to do that. It will show up again at the end of the show, and we're very thankful.
Thank you for the chance to talk about it.
We want to switch gears just a little bit, and we want to now visit with someone who has been a care provider herself for more than 16 years, caring for her mother, caring for her at home. We're going to meet Ella French. Stay with us.
I'm Ella French. I'm a 24-hour-a-day, 365 days out of the year caregiver for my mother. Started 16 years ago when my mom became blind. And 5 years ago, October the 5th, it became 24/7. I quit my job that I had and I devoted my life to my mom, taking care of her. The reason that I'm providing my mother the care that I do is, for one, I love her. Unconditionally, I love her. And I don't feel that any of the facilities in Fremont County that we have would give my mom the kind of care that I give her. And I love her. Through the years, I've tried to get some people to help me so I could have a break. I've had a few on and off over the years, some that was really good that moved away that would help me. Most of them now, they just want the money, and I actually bought cameras and found out that with my mom having dementia that they were not very nice verbally, and I told myself, no more, because I will not tolerate that with my mom. It's, you know, it's a disease. It's something that they can't help, and my mom is never mean with hers, never. Financially for me, it's been a burden, a huge burden. I had money saved for myself over the years. That's been depleted. The first couple years I was taking care of my mother, I didn't know of any program that was in Wyoming that helped me to take care of my mom, that gave me a couple hours a day. One of the health nurses turned me onto that. So I've been on that since then, and every little penny counts. But you definitely, it has its ups and downs, a lot of flaws in it. I feel that I've saved the state of Wyoming thousands and thousands and thousands of dollars by keeping my mother in her home. And I know I have, because she takes a lot of care. When she goes to the hospital, I'm there 24/7 so that she gets the right care. I would wish that the state of Wyoming could provide for us caregivers a little more than what they do in my situation and probably others. And my big battle was the first couple years I had a gallbladder attack, so I didn't have medical insurance. And it's hard when you're sick to take care of somebody that's also sick. And until Obamacare come out, I didn't have any, and I was thankful for that. I even wrote him and told him, and he sent me a card back, because I was very thankful when I got my medical insurance. I went and got my gallbladder out. Even though I get the Obamacare, it's still real expensive for me, because they take a percentage of what I make I have to pay, and I don't make a big percentage. What I get to live on is bare minimal. So it's hard. It's really hard. And I think that the state should offer caregivers medical insurance. I know a lot of other states do. I've researched it, and they offer their caregiver their insurance, medical insurance, because they say that the caregiver needs to take care of themselves so they can keep taking care of the person they're taking care of to keep saving the state money, which makes a lot of sense to me. And I wish that they could do that our state would do that for us. Before my mother became ill, I had a teaching degree, a real estate license. I also was working at a hunting lodge and a ranch that I loved. I had all those jobs. I was well prepared for myself, and it changed. I got a phone call and it changed instantly. And you have to pick and choose what road you're going to go down, and I naturally picked my mother. It didn't matter at that time, the cost. I had a $6 million plus ranch that I was in the process of selling, and I gave it all away. I had to, and I made my choice to take care of my mother. People ask me how I get by and doing what I do and how I do it. For one thing, I pray to the good man up above. I say a lot of prayers. It's tough, do a lot of crying, but I manage. We always get inner strength that keeps us going, and how do I get by? And you live within your means. And good thing I have a boyfriend that helps me. He's a blessing since I met him.
And now we're pleased to be joined by Lisa Oswald with the Division of Aging in the Wyoming Department of Health. Lisa, welcome to Wyoming Chronicle.
Thank you. Thank you for having me.
You're welcome, Lisa, and thanks for being with us. You have had a chance to kind of understand Ella's story, and I want to begin with a discussion about someone like Ella, who may not know of all of the different programs that might be available from the state of Wyoming. What should someone in her shoes really do and continue to do?
Right. Well, the very first thing I think someone in Ella's situation, or similar to her situation, it's really important that they reach out to either the Aging Division to find out about all the resources, and they can also reach out to their Senior Center. The Senior Center is really the hub in every community for older adults. And if all else fails, they can reach out to 211. That's just easy. Call 211 and mention that what kind of services they need. That's a social service database to really help people find those services in their community. So
when you say 211, that's just like 411
like
or
411.
911, but it's
right.
just for people that have social needs in the state of Wyoming,
Exactly.
and specifically maybe caregiving issues, a
Exactly.
resource that they can do. And I want to let our viewers know that we're showing now the website address for the Division of Aging, and we'll have other resources on the screen too. And I think that people often, Lisa, find themselves in this situation overnight.
That's right.
On an instant, without really much pre-planning.
Yep, and that definitely can happen. And so it's really important that we have these conversations around the dinner table, even before all this occurs. And talk to your parents, and parents need to talk to their adult children and let them know what their wishes are. 80% of older adults want to age in place. They want to be home in their communities. They don't want to have to go to a skilled nursing facility. And so what will that look like for them? It's important that they talk to their adult children or their other family members and find out what that looks like and what that means. And so it's really important to have those conversations early. As we mentioned before, it doesn't have to be a legal discussion at this point, but just find out what are your wishes.
So someone calls your office. Mm-hmm. Someone here picks up the phone. What's going to happen next?
We're going to find out first where they live, because the resources, the communities all look a little bit different. And so first we're going to find out where they live and what kind of services they need. And then we're going to connect them to one of our providers. We have over 50 providers in Wyoming that the Aging Division contracts with, the federal programs and state programs. And there's many resources out there for the care.
In every county. In
every county. But they are going to look a little bit different. You know, in some of our very more rural communities, it is a little bit of a struggle at some point. But I think the Senior Center is a really great opportunity. You find out what they have. In many cases, it's the Senior Center themselves that are offering some of our caregiver programs. If it's not them, however, they definitely will know the resources in the community.
And what sort of programs are there?
Well, we have many, and it would really, there's state-funded programs called WISE, the Wyoming Home Services, and there's also some national programs, federally funded programs, the National Caregiver Program, the Senior Companion Program, And it just kind of really depends on what that caregiver needs for their loved ones. For example, it might just be that they need a noon meal at the senior center and some social activity that they could easily be taken care of at that senior center. But then they might need more intense care. They might need someone coming in to give direct care and maybe help with their daily living, you know, bathing and dressing and feeding. And so really it will depend on what kind of services. And I think that's why it is so important to have those conversations early, because it can be such a variety of needs. I think about some of our programs in the WISE program, for example, Wyoming Home Services. That is available to anyone over 60. There is no income eligibility, and it can vary, again, from having someone coming in and providing direct care to helping them run errands to even giving the caregiver some respite time, because as we know, being a caregiver is not only a financial, can be a strain, it also can take an emotional toll on someone. So they give a chance for that person to maybe take a little break and have respite care for.
Lisa, there are people, maybe even that are aging, that are thinking, well, I don't need help. Mm-hmm. I can do this alone. And then maybe a small problem gets to be a little bit of a tougher problem. What advice would you give to people who really may not be that far away from really needing help here in Wyoming?
Again, I would think it's important to have those conversations early and to really sit down and start identifying what are some of the challenges that I am having in my daily life. I give you an example. I have a sister who's 75 years old and lives in the mountains. She's very active, she's very healthy, she is a volunteer first responder, but she also is a nurse, and she knows that there's things that can happen to her as she ages that she might need help with. Living out in a very rural community, Ryan Park, then she's going to start, we're starting to have those conversations to say, what would it look like if you needed someone to come into your home? Would you be able to find someone? As that is a big challenge in Wyoming in some places, to finding the qualified workforce to get here. So we'd like to have those conversations early. That's what I would encourage.
Many people, to put it really as straight as I can, might be concerned about the state of some of Wyoming's nursing homes. Mm-hmm. You've been to many nursing homes in Wyoming. What is your take, and what advice do you have for people that might be looking at or needing nursing home assistance?
Well, I think there's a lot of great facilities out there, and I think though it's prudent to do that research for your loved one and for yourself. And so I would encourage anyone looking at a nursing home or assisted living facility, go to cms.gov, and they will actually rank the nursing homes. And so you can kind of determine from that ranking whether or not that's a good fit for you. It is important to know, though, some of those rankings can change. You might have a nursing home that maybe didn't do so well on their last survey, what's otherwise known as an inspection, but then they're very committed to getting that taken care of, and they get that turned around and their ranking goes up. So I think just go in, that's one way. I would go visit the nursing home, talk to the nursing staff, talk to the CNAs. They're the ones who are going to be delivering the most care for your loved one on a day-to-day basis. So talk to the staff. You'll get a feel for it if you go in and visit. Don't just talk to the administration. I think it's important to talk to the actual people caring for your loved one.
We talked about one legislative effort in Wyoming earlier in the show, the ISPOLST effort. There are a couple of other bills that have recently passed the Wyoming Legislature that you want to talk about.
Yes, I'm very excited about a couple of them. The Palliative Care Act, that was passed last year, and that really is to form an advisory committee. It's out of the aging division. And palliative care is just really trying to look at making sure we're treating the symptoms of someone who is chronically ill or near at the end of their life, and treating their symptoms and making them as comfortable as possible. So this is a task force that we're formed and we're working on. And then last year also the CARE Act was passed unanimously in the Wyoming State Legislature. Governor Meade signed it into law, and it went into effect July 1. And the CARE Act is very important to providers. It really is requiring hospitals to make sure that they notify caregivers when the individual is in the hospital. Their name has to be recorded on the medical record. They also have to be notified when that patient is released or transferred. And most importantly, they also have to be given really good instructions on how to care for their loved one upon discharge. A lot of hospitals, and this is a new act, a new bill, so we make sure we have to educate and ask the hospital about the CARE Act and how that applies to them.
Lisa, as people are aging, there are more workers needed to support those who are aging. Wyoming's trying to improve at least what it does with CNAs, or certified nursing assistants.
Yes, and we know that's a struggle in some of our communities to find qualified CNAs. And so we are looking at a pilot project. The Aging Division is partnering with the Department of Labor apprenticeship program and some other providers and potentially a community college to maybe develop an apprenticeship program for CNAs. We really feel like we, as the providers, know what they need, the individuals who need the care know what they need, and we really want to kind of build our own and try to have a CNA program. Now, this is very much in the infancy stage, and we're just trying to get it to underway now, but I'm very excited about the possibility. CNAs are really the ones who deliver that day-to-day care, and they're just so important, and we want to make sure that they're recognized, how important they are, and that they receive the quality training that they need. Now, of course, this won't be a mandated program, but more that a provider could choose that, or a community could choose that for their area.
Bottom line, in just a word or two, people need to plan ahead.
Plan ahead. And it's okay, we're all aging, and it's okay that we're aging. And so let's go ahead and have those conversations now. They don't have to be scary, and just, be open with your loved ones about what you would like to how your last 20, 30 years of your life would look like.
Great, Lisa. Well, good advice, and I think it's advice we should all take into account. Lisa Oswald from the Division of Aging within the Wyoming Department of Health, thank you so much for joining us on this Wyoming Chronicle.
It was a pleasure to be here.